Hello, you are listening to the RxConnect podcast. This podcast is brought to you by the pharmacy operations at the American Oncology Network. We are committed to delivering operational, clinical, and financial efficiencies based on the most sustainable model, reshaping the future of community oncology practice. I'm your host, Melody Chang, Vice President of Pharmacy Operations at the American Oncology Network. To listen to the podcast and to read the transcript, please visit our website at www.aoncology.com. In the past episode, we talked about cellular therapy, especially bispecifics. Bispecific antibodies represent a new treatment option for patients with cancer. These antibodies activate the patient's own T cells to kill their tumor cells and have shown impressive results in various cancers like myeloma, lymphoma, even small cell lung cancer. Today, we are going to focus on overcoming challenges to initiate bispecific from nursing perspective. I'm delighted to welcome 4 special guests today to share their experiences of administering bispecific with our audiences. My first guest is Christine Terrell, clinical nurse manager from Hematology Oncology of Indiana. My second guest, Abby Davis. She is also from Hematology Oncology of Indiana, and she's an oncology infusion nurse, and triage nurse. My third guest is Brooke Peters, clinical pharmacy service manager at American Oncology Network. And finally, my fourth guest is Cassie Perkey, regional clinical pharmacist at American Oncology Network. Welcome, everyone. So to begin with, I'll start ask Chris, how long have you been administering bispecific therapy at your clinic?
Hi, Melody. Yes, we have our first experience with teclistamab was in November 2022 through an expanded access program prior to the FDA approval. This required coordination with our local hospital for drug ordering and staff training for a step-up dose administration, which helped us in our transition with these drugs started coming to market.
Wow, it's over a year, huh?
Yes.
Great. So Chris, could you also tell us from a nursing perspective, are there any differences in administering bispecific antibodies compared to regular oncology infusions?
Well, as you mentioned, the bispecific antibodies are designed to engage 2 different targets simultaneously, which can introduce more complex mechanisms of action compared to traditional monoclonal antibodies. The nurses really need to have an understanding of these mechanisms to effectively monitor and manage patient responses and potential side effects. The unique action of the bispecific antibodies can lead to specific side effects such as cytokine release syndrome, infusion-related reactions. Nurses really need to be diligent in identifying early signs of these reactions and confident in executing intervention protocols promptly. The administration of bispecifics may require different infusion protocols. Most of our infusions include pre-medications. We vary the infusion rate, but most post-infusion monitoring and managing adverse effects. And then really effective administration of bispecific therapies often involve close collaboration with multidisciplinary teams, which includes your oncologist, your pharmacist, and your nurses. Teamwork is vital to align the treatment plans, manage complex cases, and ensure holistic patient care.
I see. So I can tell while the foundational skills of oncology nursing applies, the administrations of bispecific antibodies requires additional specific knowledge, vigilance, and interprofessional collaborations to manage the unique challenges this therapy presents. My next questions I'm going to ask Abby. Can you discuss the training required for nurses to administer the bispecific therapies and who provides you the training you need?
Sure. So with any new bispecific product, we typically get a hold of Cassie and Brooke to help create an education resource material for not only us nurses in infusion, but also triage nurses, the providers, and also the patients. Patient education is a huge process with these therapies, any therapy, but especially these ones, and any potential trial medication we administer. Education and training is very, very important. So we typically cover mechanism of actions of these different bispecific antibodies, their protocols, because again, like Chris had mentioned, there are different protocols for these different medications, and also going over emergency procedures for any potential adverse reactions. And again, that's where the triage nurses come into play, making sure that they have the appropriate outline of how to handle that process. And then also having REM certification, that's also another part that the providers and triage nurses assist with.
Great, great. So it looks like a lot of training involved. So I'm going to ask Brooke. Brooke, as a clinical pharmacy manager, how do you contribute to the multidisciplinary team's decision-making process regarding bispecific treatment?
Thanks, Melody. So I think the first step as far as multidisciplinary conversation goes is identifying where these therapies fit in. What's our appropriate patient population, and how does the efficacy and safety of these therapies compare to alternatives? I think then engaging the multidisciplinary team to discuss logistics is important. So what new challenges are we going to encounter with these agents, and how do we overcome them? So that requires coordination with hospital teams, certain financial considerations, staff training for new toxicities, perhaps keeping new drugs on hand for the treatment of these toxicities. There's a lot of new considerations with these drugs, and engaging with the multidisciplinary team early becomes very important to get these treatments started in any facility.
Yeah, absolutely. And then I know you and your teams prepare a lot of SOPs for American Oncology Network across the network we can adopt, and therefore, as for our community oncology, we really are administered more bispecific therapy currently. I believe we probably have around 300 administrations of bispecific already so far. Am I correct?
That's right.
Okay, that's excellent. So my next questions, I'm going to ask Cassie, as a regional clinical pharmacist, could you share with us what resource have you been able to provide to your region?
Of course. So recently I've worked with Chris and Beth Romano, one of the APPs from Hematology Oncology of Indiana, and Brooke to develop a training module for nurses and even pharmacy technicians that focuses on management of CRS and ICANN. So a couple of the main side effect groups of these cellular therapies. And this training includes tips for patient education, grading of the toxicities, and outpatient management, even how to order, prepare, and administer tocilizumab in case of these toxicities. So this training is now available to all nurses within AON. And then, like Brooke was saying earlier, when we hear that a patient is going to be starting on a bispecific therapy, the regional pharmacists also will at that time help with refamiliarizing the nurses and other staff, the multidisciplinary team at the clinic with the AON SOPs for cellular therapy initiation. And then often we're helping with coordinating an in-service or other training for the clinic staff sometimes with our pharma partners before treatment initiation. And then, as always, as patients continue on therapy or as new patients arise, the regional pharmacists are always available to help answer any questions as they come up.
Wonderful, wonderful. Thank you, Cassie. And I know the nurses play a pivotal role on the patient education as well. Chris, could you tell our audience, how do you prepare your patients for bispecific therapy?
Sure. Yes, we really just kind of sit down with the patient and get their understanding of their diagnosis and, what they know about the bispecific therapy. Go through the outlines of what to expect during while they're here in infusion, what the nurses will be doing as far as, monitoring their outcomes and just their symptoms. What really is too is their side effects, to make sure that they're in tune with what could potentially happen and tell them that it's okay to call. We expect them to call. Some patients don't like to call because they feel like it's a bother, but it's really pushing that to let them know that we are expecting these symptoms and we really want them to be in tune and call us immediately. And then it's just really making sure that they have other support services, if they need financial counseling, patient support groups, anything to make sure that their journey can be as smooth as possible.
Excellent. Yes, by focusing on these areas, nurses play a crucial role in ensuring patients are well prepared and supported throughout their specific therapy. So, Abby, as a triage nurse, how do you usually educate your patients who are on bispecific therapy?
One of the biggest aids in helping us do this is making sure we have responsive communication, making sure we have that first point of contact, which is initially at the first office visit, patient education with our nurse practitioners, and then going over any potential side effects or concerns that they have before their treatment, during their treatment, post-treatment, and making sure that we follow up and monitor them as closely as possible. Most of the time with these bispecific therapies, we're having patients come in 2 to 3 times a week with visiting a nurse practitioner, checking in with the infusion team, getting any potential IV hydration or medications that might be necessary to help with managing side effects. And then we also have follow-up nurse triage phone calls, especially after the first initial treatment and then the first couple of treatments. Again, really close follow-up and monitoring on these patients. And kind of like what Chris had said, making sure that these patients are calling us, encouraging them to be very active in their care, and making sure that they understand the importance of adhering to their treatment schedules, letting them know that there might be possible lifestyle adjustments, and letting them know that support systems are very huge in this process, from our team, any caregivers that might be involved. And again, just very, very highly aware to educate patients about any potential side effects and to let us know immediately.
Thank you, Abby. And thank you for ensuring our patient has a better treatment outcomes and have a good patient experiences. So would you be able to share with our audience what this question is going to be for Abby? What are the biggest challenges you have had to overcome with administering bispecific therapies?
I think our biggest challenges are the differing potential side effects from each bispecific therapy. We have these guidelines and protocols that Cassie and Brooke have helped us create with the ICANN CRS, and each therapy can treat and each patient differently. So we have to be very cognizant of everybody's case and scenario of these medications. So I would say that would be the biggest challenge, is differing, what to do with certain medications and for the certain patients that are receiving their treatments.
Great. As we come to the end of the program, I'd like to ask Chris, do you have any advice for our audience, especially for our nurses who would like to get themselves ready to start a bispecific program at their clinic? Could you give us some advice?
Yes, I would say definitely reach out to your physicians, your pharmacy team, and even the vendors to help coordinate the education for your staff. Understand that unlike other therapies, these patients are more likely to have side effects outside of the infusion area. So you really need to expand your team to include triage, as Abby's mentioned. Some of the tools that we've created are building in reminders in the patient's charts for our nurse triage team to expect what side effects at certain times for these patients. And so if a patient should call, they know kind of what to expect or what to focus on, or if the patient doesn't call, we should be hearing from them. So maybe reaching out to the patient. Educate your patients, encourage them to be active in their care. It takes everyone, and don't be afraid to ask and encourage your patients to do the same.
Excellent. Yeah, before we conclude today's episode, I want to thank our guests for sharing your valuable insights and expertise with us. And we are truly grateful for your time and knowledge. And I'd like to thank our audience for listening. This podcast is brought to you by Pharmacy Operations at the American Oncology Network. You can listen to all the podcast recordings on our website at www.aoncology.com. And we hope you enjoyed this episode and look forward to seeing you at the next one. Thank you.